happened yesterday. I think it's important to begin to set the stage for what we're doing. So I'm going to ask Dr. Diane Wood to just kind of recap what happened yesterday and to talk about her project in the year.
I am the project director of a statewide contract, which is the California Reducing Disparities project. And that particular project is to go out, talk to individuals related to their perspective on mental and behavioral health, and specifically regarding prevention and early intervention. So in other words, what is it that people believe they need in order to have good mental health? What does the system need to look like? And how do we need to have programs put in place so that service delivery is appropriate and meeting the needs of people when they come in for issues? And that's the term, and when we're collecting our data, that people identified related to mental situations. People do not like the term mental illness, so I'm refraining myself from using that particular term. In addition, the project was not just associated with one population. It is an ethnic-based initiative. And with this particular initiative, the Mental Health Service Act funds, Proposition 63, was actually utilized to fund the statewide effort. There were 5 ethnic groups that received fundings to work with their population. That is the Native American group, the lesbian, gay, bisexual, transgender, the Asian Pacific Islanders, the Latinos, and the African American population. And each one of our proposals, we proposed a different perspective as to how we would work with our population to understand what they felt was important to them. Yesterday was a culminating activity for our particular group. Statewide, we brought individuals in, including with an oversample of client family members, and community members, so that they then will have the opportunity to look at the report before it goes to the state, and then to be able to take the recommendations that were gathered during the report. And so everyone received a copy, and some of you have a copy, 125 recommendations related to practices. And these practices were not categorized, or they were not actually synthesized to be broken down into different levels as to how they are to apply within a person's region or within the community. A part of the task yesterday was to actually look at that and get a consensus as to how we were going to put forth these final recommendations. In addition to the 125, there were 30 final recommendations, 30 or 35 of those that people were given. These recommendations came forth, and it's important to know, from the population. We used a mixed method approach. I'm a community researcher. We used a mixed method approach, which included focus groups, one-on-one interviews, surveys administered in multiple ways, whether it was online, in person, or by email. We also had public meetings, public forums, and one-on-one interviews. The intent for our black population was to use what we understand about our people. That is, that we like to talk and to share and to tell our story. And so in order to do that, we had to do that in a very synthesized and organized manner. So that's why you see the multiple ways. Also, it was to take away from the concept that it's an anecdotal approach. It's just somebody's opinion. It is not someone's opinion. It's actually the thoughts, the feelings, the ideas of the people in whom we talk to. Did we use traditional individuals, the same individuals that's been involved in processes within the county? Some of those individuals. But more importantly, we used a word of mouth regarding recommendations. We were strategic. We wanted to know where in the state of California did we have the highest concentration of our black population, and actually it's in 6 counties. So we targeted those particular counties to make sure that we heard from those individuals, and then went down the line to engage other people, at least as many as we possibly could. So today we are here, and I would like for those who were part of the group yesterday to please stand. So I want the people to come on, people. It's early, I know. Aren't they beautiful? more.
Well, I think in the question and answer, we'll get a chance to get.
Thank you.
Thank you so very much.